It's Howard from Bali Beginnings, and today we're going to be discussing medical standards and the need for excellence. So medical standards is something we did very well before. We brought to the land of Bali 24/7 medical care. We had a nursing team as well as doctors that would visit, so we always had a medical presence on site 24 hours a day, 7 days a week, in line with best practice guidelines in Australia and NICE guidelines in the UK. And the good thing about this is it forced other rehabs around us in Thailand, in Bali and other areas to at least claim to follow the same standards. And why is it so important? It's so important because, let's be honest, we can deal with life and death, particularly detoxing from alcohol or prescription drugs can be some of the riskiest experiences in people's lives, which is why we need to get the processes so right. So how have we looked to improve after COVID? We now have a medical director. She looks after all of our policies and procedures, nursing SOPs, standard operating procedures, and making sure that we follow the best practice guidelines. We will soon be a registered clinic in Bali, which we will be the only ones to be a registered clinic within Bali. We have a full-time doctor who will be with us 5 days a week, which puts us in the top 10% of rehabs worldwide, and it's something we think so essential. But also just having the basics here that so many rehabs miss. We have receipts from our defibrillator from all the way back in 2017, and we've never had to use it, thank God, but we have it in case there is a situation that requires starting someone's heart. That's quite a severe situation. Would you rather send someone to a place that has the equipment to do that, or to someone who hasn't even thought about that? We have oxygen, again, we've never used. We have a wheelchair we've never used. We have crutches, we have medical beds, we have all the best medical equipment that puts us essentially in line with any rehab worldwide to give people the emergency care they may need in the worst of situations. We plan for the best, we act as if the best, but prepare for the worst. You've got to always prepare for the worst. Hopefully we never have to use a lot of these equipment, but like I say, I'm very glad to say we have a lot of this equipment just in case the worst should ever happen. So, please, 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 if you're thinking about rehab, make sure you send yourself or a loved one to a place that considers these things, because otherwise the worst can and sadly occasionally does happen.